Caring for someone who is bedbound involves more than just providing meals and medication. It is also about keeping their body as healthy and comfortable as possible. This is where range of motion exercises become very important. These are gentle movements that help keep a patient's joints and muscles working well. There are two main types. Active range of motion is when the patient can move their own body parts with some help or guidance. Passive range of motion is when you, the caregiver, gently move the patient's joints for them because they are unable to do it themselves. These exercises are crucial for preventing many problems. The benefits of these exercises are truly significant for a patient's overall well-being. When a person lies in bed for a long time, their muscles can become weak and tight. Their joints can get stiff, a condition known as contracture, which can be painful and limit movement permanently. By performing these simple movements every day, you help prevent these issues. You are also helping to improve blood circulation, which is vital for healing and preventing dangerous blood clots. Good circulation ensures that oxygen and nutrients reach all parts of the body, keeping the skin healthy and reducing the risk of pressure sores. Before you begin any exercise session, it is essential to create a safe and comfortable environment for the patient. Make sure the bed is at a comfortable height for you to work without straining your back. Explain to the patient what you are going to do, even if they are not fully responsive. Use a calm and reassuring voice to help them feel relaxed. Communication is key. Always ask them to tell you if they feel any pain or discomfort during the movements. Your goal is to help, not to cause harm, so being gentle and attentive is the most important part of this entire process. Remember to always support the joint you are exercising. For example, when moving the arm, you should hold the wrist and elbow to provide stability. This prevents strain on the joint and the surrounding muscles. Never push a joint beyond its natural point of resistance or to a point that causes pain. The movements should be slow, smooth, and deliberate. Think of it as a gentle dance rather than a workout. This careful approach ensures that the exercises are beneficial and therapeutic, helping your loved one maintain their physical health and feel cared for in a compassionate way. We will start our gentle journey with the upper body, beginning at the head and neck. These movements must be done with extreme care. To begin, have the patient lie flat on their back without a pillow if possible. Gently place one hand on their forehead to support their head. Slowly turn their head to the right, as if they are looking toward their right shoulder. Hold for a moment, then slowly return to the center. Repeat this movement to the left side. Next, you can gently tilt the head, bringing the right ear toward the right shoulder, and then the left ear toward the left shoulder. Never force these movements. Now let's move down to the shoulders, which have a wide range of movement. With the patient on their back, support their arm by holding their wrist and elbow. Gently raise their entire arm straight up toward the ceiling, and then slowly bring it up toward their ear, as far as is comfortable. Return the arm to their side. Another important movement is moving the arm out to the side, away from the body, like an airplane wing. Again, move slowly, and only as far as it feels natural. These exercises help prevent a frozen shoulder, a painful condition where the joint becomes very stiff. Next, we will focus on the elbow joint. The primary movements for the elbow are bending and straightening. Continue to support the patient's arm at the wrist and just above the elbow. Gently bend their arm, bringing their hand toward their shoulder. Then slowly straighten the arm back down to the bed. Repeat this motion several times. You can also turn the forearm. With the elbow bent, gently turn the palm to face up toward the ceiling, and then turn it to face down toward the bed. This helps maintain the flexibility needed for simple tasks like eating or holding objects. Finally, we arrive at the wrist and fingers, which are vital for daily activities. Support the patient's forearm with one hand and hold their hand with your other. Gently bend the wrist forward, as if pointing their fingers to their toes, and then backward, pointing their fingers to their head. You can also move the wrist from side to side. For the fingers, gently open their hand and straighten each finger. Then, close their fingers into a soft fist. Don't forget the thumb. Move it away from the palm and back again. These small movements are very important for keeping the hands functional. Now we will shift our focus to the lower body, starting with the large and important hip joint. The hip connects the leg to the body and is crucial for any potential mobility. While the patient lies on their back, place one of your hands under their knee and the other hand under their heel for full support. Slowly and gently bend their knee up toward their chest, as far as it will comfortably go. This movement also flexes the hip. Hold for a moment before you slowly lower the leg back down to the bed, keeping it straight. This helps maintain flexibility in both the hip and knee. Another critical movement for the hip is moving the leg away from the center of the body. Keeping the patient's leg straight, continue to support it under the knee and heel. Gently slide their entire leg out to the side, away from their other leg. Move it only as far as feels comfortable and natural, without causing any strain or twisting in the hip. Then, slowly slide the leg back to its starting position. This motion, called abduction, is very important for preventing the hip joint from becoming tight and helps prepare the body for tasks like getting out of bed or shifting positions. After exercising the hip, we will concentrate specifically on the knee. The knee joint primarily bends and straightens, a motion we already started when exercising the hip. To isolate the knee movement more, you can have the patient lie on their side if it is safe and comfortable for them. However, it is often easiest to continue with them on their back. With the thigh supported, you can focus on bending and straightening the lower leg. Support the leg under the knee and at the ankle, and then gently bend the knee as much as possible, then straighten it again. Always be mindful of any signs of pain. Throughout all these lower body exercises, your support is paramount. The leg is heavy, and without proper support, you could accidentally cause strain to the patient's joints or even your own back. Always use good body mechanics, keeping your back straight and using your legs to lift. Position yourself close to the bed to avoid reaching and leaning. By ensuring the limb is fully supported, you make the experience safer and more comfortable for the patient. This steady support allows their muscles to relax, making the exercises much more effective in preventing stiffness and promoting circulation. We complete our full body routine by focusing on the ankles and toes, which are often overlooked but are essential for balance and standing. To exercise the ankle, support the patient's lower leg with one hand and hold their foot with your other hand. Gently push their foot forward, pointing their toes away from them, in a motion called plantar flexion. Then gently pull their foot back toward their shin, pointing their toes toward their head, which is called dorsiflexion. This simple back and forth movement helps prevent foot drop, a condition where the muscles needed to lift the front part of the foot become weak. Next, you can move the ankle in circles to maintain its rotational flexibility. Continue to hold the foot firmly but gently. Slowly rotate the entire foot in a clockwise circle several times. Then reverse the direction and rotate it in a counterclockwise circle. These circular motions help to lubricate the joint and keep all the small supporting muscles and ligaments flexible. After the ankle, move on to the toes. Gently curl the toes downward, as if they are trying to grip something, and then gently straighten them back out. Do this for all the toes together. With the exercises complete, it's important to discuss frequency. Ideally, these range of motion exercises should be performed at least once a day, but twice a day is even better, perhaps in the morning, and again in the evening. Consistency is more important than intensity. A few gentle repetitions for each joint every single day will do much more good than a long, strenuous session once a week. You can incorporate these movements into daily care activities, such as during bathing or dressing, to make it a natural part of the routine. Always listen to the patient and watch their body language. In conclusion, remember the core principles of safety, gentleness, and consistency. Your role as a caregiver is incredibly valuable, and by performing these exercises, you are actively improving your loved one's quality of life. You are preventing pain, maintaining mobility, and showing them profound care and compassion. Always check with a doctor or physical therapist if you are unsure about a movement or if the patient experiences persistent pain. Your dedication helps keep the patient's body strong and their spirit more comfortable during a challenging time, which is a truly wonderful gift.